One of the most common things to not only affect athletes, weekend warriors, but also people that sit a lot is tight hip flexors. If you have persistent low back pain, check and see if your hip flexors are tight. Sometimes getting those loosened up is the key to resolving other issues. So before I show you how to use the BioZoom for hip flexors, we are going to show you the anatomy so that you really understand how involved this whole system is. If we look at the front of the leg, we can see that the hip flexor muscles actually come from deep in your low back. So when we start this, we're going to start up high in the upper part of the hip crest and then work down towards the middle of the thigh bone. Here's what that looks like therapeutically. For the tip, I would recommend starting with the yellow. It's going to be some sensitive areas. Usually people have trigger points, so start with the yellow tip. We're going to set it to the 5 frequency. And when you're starting, what we want to do is start with the hip. I recommend starting, turn your leg out 45 degrees, hold the BioZoom so you can get nice comfortable pressure and position. Start right below the bone on your upper left of your hip. Start just inside, applying pressure to comfort. Slight motion down all the way to the knee. Begin in a neutral position. As you make multiple passes, put slight flex bend into the knee. Rotate out slightly to get different angles, and you should feel a deep pressure. When you find the tender spots, work those out as well. Moving to the side, you can get just above the hip, even up on the hip crest, again to comfort level. Go in just above the hip crest to see if you have tension spots there. As you make multiple passes, add extra flexion to really help isolate where the tension may be coming from. Do both sides, 3 to 4 passes. Start off with 60 to 90 seconds and see if that helps loosen up those tight hip flexors.